I no longer look after little kids, but the population is my patient. Women, and particularly younger women, are catching up to men in terms of some of the alcohol-related harms and risky drinking behaviours.
Can we talk about the flu?
This particular strain tends to affect younger populations, so it's not too late to get vaccinated.
The flu, infectious diseases, and the general health of all Canadians, all top of mind for Dr. Theresa Tam, Canada's top doctor.
Presence of the virus.
She's the third person to head the Public Health Agency of Canada since its inception in 2004, and she has a self-proclaimed passion for viruses, bacteria, and vegetarianism. So we came here to Pure Kitchen, a vegetarian restaurant and juice bar located on Elgin Street in Ottawa.
Why did you choose Pure Kitchen?
Well, I love vegetables and I think the food tastes great, but I also think there's a lot of creativity in this menu, so that's why I like this particular.
Are you a vegetarian?
I am.
Oh.
Yes.
Why? Have you been one for a long time? Is it a
Quite
lifestyle
some time. It's been a bit of an evolution, I think, over my lifetime. But a few years ago, I really read the data on the environmental impact of, say, the energy that it takes to raise a kilogram of meat compared to that of plants. So that was my personal experiment and challenge to see if I can contribute just a little bit also to helping reduce our environmental footprint.
Hi.
I've just been inspired by the Brussels sprouts.
I'll have the soup as my main, and can I have the celery juice, the small size, please? Sure. So tell me a bit about your background and how you arrived at this job.
I went to medical school and in the UK, in England. And when I finished medical school, there wasn't much that I didn't like. When I came to Canada, and I looked at the options that were available to me, at that time I chose pediatrics. But I love kids fundamentally, so I went into pediatrics, and I specialize in infectious diseases. And
what does that mean in layman's terms?
We're subspecialists, which means we do a deep dive into what might be causing someone's fever or their ill health. I got introduced to public health when I got a job with Health Canada at the time as a field epidemiologist, which meant that we were what some people call disease detectives. We went on the ground to investigate what causes outbreaks, which really married up my passion for viruses and bacteria with my, I guess, inquisitiveness on how to investigate outbreaks.
So how did you go from that to becoming the top public health official in the country?
I was interested in this role because it gave me the next level of challenge, I think, in the context of the federal government. So I wanted to see whether I could take this position to the next level in communicating facts, communicating science, communicating public health to the minister. Oh, thank you.
Cheers.
This is great. I briefed ministers and have done throughout my career for a number of years, but this definitely it brings me much closer to the Minister of Health.
What's the potential for impact there? Like how much, and I don't mean this in a, how much power do you wield with politicians?
I work very closely with my Health Canada colleagues, and when we brief the Minister on what we have analysed and the information that goes towards the policy making, I'm there, and I think that puts me in a very privileged position to influence policy making.
Can we talk about the flu as well?
Yes.
So I read...
One of my favourite viruses.
Is
because
it?
I spent my career actually studying influenza.
I love that you have a favorite virus, a passion for bacteria and a favorite virus.
Yes.
Our flu, can you give us a sense of where the flu numbers are at this season? Should we be concerned?
Yes, I think influenza, why I'm interested in it, is that it's a very underestimated and underappreciated virus. People go, oh, I think, it's just the flu. Well, influenza can cause up to 12,000 hospitalizations, 3,500 deaths a year. That's nothing to sneeze at, as it were. But influenza is unpredictable, and every year the flu season can be a bit different. So different viruses circulate around the world, and this season the influenza A, H1N1, that is the name of the strain that is circulating the most. But this particular strain tends to affect younger populations. Mm-hmm. We think because the older populations may have seen a previous virus in their lifetime, whereas the younger generations haven't been exposed to a similar virus, so they tend to be impacted the most. So we are seeing hospitalizations in kids, and we're seeing some severe outcomes.
What does that mean if you're a parent watching?
If you're a parent watching, I think that get vaccinated. So anyone over the age of 6 months, we recommend influenza vaccine. Which is safe, and it just adds another layer of protection, I think, for your kids. We, of course, advise people to practice good cough etiquette, hygienic measures. And stay home when you're sick. I think that's sometimes difficult for parents and for people, because when your kid is sick and you still have to work, you have to arrange for childcare, and
it's really
you have to
hard,
stay at home. But that is a way of preventing spread, and so we definitely encourage people to stay home when they're sick.
Marijuana. What is your role? Do you have one, I guess, when it comes to legalization of marijuana?
Absolutely. I see my role as making sure that people are aware that just because something is legal doesn't mean it's harmless.
Are you worried that legalization sends the message that it's okay to use the drug?
I think it is a concern, which is why it's really important to get the facts out, but get the facts out in a non-judgmental way. So I think continuous education is needed. I think once it's legalized, it's easier to talk about cannabis and to actually improve education. Before legalization, people were probably reluctant to speak frankly about cannabis use in the family setting or in the school setting. So I think we should make the most of that opportunity.
And you also have made alcohol use among young women a priority. Tell me a bit about why you're worried about the numbers.
Women, and particularly younger women, are catching up to men in terms of some of the alcohol-related harms and risky drinking behaviors.
What is risky drinking behavior?
Risky drinking consists of drinking really large amounts in one sitting.
Kind of like binge drinking?
Like binge drinking.
Okay.
Drinking all the time, like on a daily basis, that's risky drinking as well.
What is?
And for women, for example, it's recommended you don't have more than 2 drinks a day, not more than 10 drinks a week. And on any one occasion, not more than 3. And for women, I think people are just not aware of the statistics and the fact that alcohol might have a different biological effect on women compared to men. Many people are aware of the impact of the alcohol maybe on the liver. They're not aware that alcohol is also increases your risk of a whole range of cancers, which includes throat, mouth, the esophagus, but also breast cancer. Thinking about moderation and reasonable use is probably a sensible approach.
Easiest health tip for Canadians to implement?
Eat less processed foods and walk more.
You're having a dinner party and you can invite any living people in the world. Who scores an invite?
I was quite taken by the biography by Michelle Obama. She'll be a very interesting person to have at the dinner table.
It's an interesting book. Yeah.
I've always thought Rick Mercer might be fun to have at the dinner table.
Vegan or vegetarian?
Vegan, but really I think being flexible and sensible and eat more plants.
Cauliflower or celery?
Cauliflower, definitely.
Coldest winter, Saskatoon or Ottawa? You lived in Saskatoon, as did I.
Coldest, Saskatoon, but brighter there.
Piano or cello?
I like both. Piano, maybe.
Go-to comfort food?
Lentil soup.
That is a very healthy version of comfort food. Thank you, Dr. Tam. Really appreciate it.